First, I want to thank Kate and the team at WellShare International for inviting me to be here representing MNsure to talk to you a little bit about the health market, the marketplace, the health exchange, which has been branded MNsure. Feel free to ask any questions, raise your hand, interrupt during the presentation. Generally, we like to do these presentations in a conversational manner so that everybody feels at ease and comfortable asking questions. And I know that this particular topic is of particular interest to you all, as many of you are undergoing certification and training through MNsure, through your individual and respective organizations that are represented today. I will say this to you, I won't get into details about the Affordable Care Act today, and this is not a technical presentation, although I will be answering as many technical questions as I can. For technical expertise, we want to encourage you to refer to your training, your certification, to the contact center at MNsure, so that you can be able to get your very deep technical questions answered. So today we'll do a broad overview of MNsure, but we'll dive into some areas where Kate just sees it necessary that we get a little bit more into detail, and that will include how medical assistant recipients and Minnesota Care recipients are affected, a lot of your clients, what are the services that are covered under the marketplace, and some others. So, for those of you who don't know quite what it is, I have heard it being described, the marketplace or MNsure, as a computer program. I've heard it described as, oh, that Obamacare. We are a provision, we are a snippet of the Affordable Care Act. We are not a computer program. We're a little bit more complex in that we are an online marketplace. That is a place, think of us, as you want to describe it to your clients, as that shelf at a store. And on that shelf you have commercial products, insurance products, and carriers like Blue Cross Blue Shield of Minnesota, Medica. These are qualified health plans that are allowed to sell on this particular exchange. But on that shelf we also have medical assistance in Minnesota Care. It's critical that you understand that MNsure does not replace medical assistance. It does not replace Minnesota Care. It is an offering that we have to offer to our public. And our public and the folks that we're trying to get into the system, into the MNsure system, into the marketplace, is diverse, economically, ethnically, by gender, and so we want to make sure that people understand that we are, again, that place where you can come in and get that coverage, either purchase it or acquire it for free. What are the general advantages? I think one of the things that you should talk to your clients about is people need to get convinced about using a particular product or service when it's especially new, and this marketplace is very new. This is a place where folks can get clarity. They can compare apples to apples in terms of a variety of different healthcare plans and the benefits that they offer underneath those plans. Important for them to know that if they come to the marketplace, let's say they don't qualify for medical assistance or Minnesota Care, they can get some help through some tax incentives, tax deductions, and be able to afford it. And there's a lot of folks who will come to you or who will know that they don't qualify for medical assistance, but they may qualify for a subsidized health plan through us. So it's critical that you highlight the affordability and choice aspects of the marketplace, which really don't exist out there outside of this particular marketplace. So let's dive into who we will serve. It's interesting because folks have maybe the perception that it's only for medical assistance individuals. This marketplace is for anybody who does not have coverage. For folks who are not covered under an employer umbrella, who have to go and purchase health insurance on their own. For folks, of course, many of our clients who qualify for medical assistance in Minnesota Care. But interestingly enough, it's also for small employers. We are really targeting small employers because And small employers, as we define them, is 2 employees to 50, because many of them cannot and are not currently providing health coverage for their employees. So I'll quickly go through some numbers. All in all, in the next 2 years, we hope to move about 1.3 million Minnesotans under the MNsure system, and they're defined in 3 general bucket areas. We have about 880,000 under the medical assistance and Minnesota Care bucket. In the middle, we have small businesses and employees, about 150,000 employees that fall under that small business umbrella that I just mentioned. And then about 300,000 individuals who would qualify for some type of tax subsidy and would qualify under a qualified health plan or a commercial product under MNsure. Again, focusing on what are the benefits. As you are visiting with clients and are talking to them about MNsure, about the marketplace, about affordability, it's important to highlight a couple of different things. Choice. We offer 5 health plans that are selling under the MNsure umbrella that are offering the lowest premiums in the country. So it's critical for people to understand that if you don't qualify for medical assistance, that you are probably going to, and you can't afford at the mainstream level to purchase insurance, that you could probably qualify for a pretty decent premium under our, and you'll be able to compare 5 plans in a row at the same time simultaneously and look at, what benefits are you looking for, what are your health needs, and more importantly, economically, what can you afford. So choice, we are streamlining the application. There's this issue that used to get in the middle of a lot of us getting health insurance, and that is a pre-existing condition or a current health condition, and we can no longer be denied coverage because of that. So we cannot be medically underwritten because of a pre-existing health condition, or our monthly premiums reflect that illness that we had or that we currently have. That is gone. There are no annual or lifetime benefit limits and no exclusions or waiting periods on medical plans for individuals with pre-existing conditions, and it used to be that was the case. So health plans with quality benefits, we call them the health plans that are able to sell through the marketplace that can be showcased on our shelf have to provide 16 essential benefits, and you will hear this consistently. And I know that some of you may have some questions about, well, what do we mean by hospitalizations, ambulatory services? These are just some of those essential benefits that must be covered if you don't qualify for medical assistance or Minnesota Care. And these are critical. For example, maternity. There are health plans right now that will simply not cover that, and so it's and if they do, the cost is just so high. Pediatric, dental, vision, emergency services. Well, we talk about prescription drugs, your annual visits to the doctor, and a variety of others. Pediatric, dental, and vision, mental and behavioral health. Mental and behavioral health are critical because, again, outside of the marketplace, there may be situations where some health plans may say, we have limits on the type of coverage as far as mental and behavioral health services that we can cover. So medical assistance is one of the products that we offer, one of the products on our shelf. So what would happen is, if you qualify, you will be automatically placed into free health insurance. And I think the best advice that we would give you is take the free health insurance, because the benefits that you're getting through medical assistance and Minnesota Care are comparable to the benefits that you're getting outside. So why would you want to pay a premium when you can qualify for free health insurance? Sir?
So for seniors, if they are on the Medicare and that is their primary and only insurance, would this be good? Would you recommend, I'll say, that they apply through MNsure for a secondary, sure, or would they go through MA? Or?
Great question. Could folks who are on Medicare, could they go to MNsure to get supplementary health insurance? And unfortunately, you can't. They're two very separate programs, and we don't provide that, and we don't provide gap coverage either.
Okay.
Again, that's a Medicare-based program, Very different parameters. We're talking apples and oranges here. The health exchanges and Medicare.
Sorry, piggybacking off the gentleman there, there's some communities that consider, MA, because it's free, as a welfare. They don't accept that. So how do I convince them to take something, it's free? A lot of people like free, but there's some communities that don't want something free like that. They want to pay their own way. So how do I convince them to take that?
Well, that's a great question. How do we convince folks? And there's over 200,000 Minnesotans who qualify for free insurance. They qualify either for medical assistance or Minnesota Care, and they don't take advantage of it. And one of the reasons is sort of a overall cultural reason. We don't want to take a handout. I think it's important, as we are educating the community about this new marketplace, that we talk about how beneficial it is for them to have health insurance first and foremost before addressing the issue of in particular situations, the issue of cost, what it does to their long-term health, what it does, what benefits the society reaps from them having health insurance versus showing up at the emergency and having to incur a $2,000 or $3,000 cost for a broken arm. And what that does to healthcare costs in general. So it has to be a broad education outside of just the issue of cost and money.
But they don't want to take that free, okay? So can they still pick a plan that is a paid plan and still, even though they're eligible for MA?
Well, the way that the marketplace rules function is if they qualify into a medical assistance program, they're going to be placed in a medical assistance program, and they're going to be encouraged to take it. The education piece has to, why is it beneficial for you to move away from the hand-me-down to here's the free, the giveaway concept to it's important, and you can utilize that money that you want to use to spend on other aspects of your life, on your children, on a vacation fund, on other things that can be beneficial to the family. Again, at a grassroots level, the communication has to be there as far as, well, how can you help them with some of those questions? And some of them are very private because they have to do with their personal finances and their perceptions of how that goes. So that's all I can say, Marcel. We are in that conundrum as well at MNsure. How do we change the culture of lack of insurance? This culture of people don't take it, they can get it, and we really depend on you all who have direct knowledge and insight into these families and the cultures within those families around money, around insurance.
I see that you have pediatric, dental, and vision care. Will that also cover for adults?
Well, you can purchase coverage under medical assistance in Minnesota Care. That's provided for you under a qualified health plan. It kind of depends on the health plan and the carrier and what you go by, but it's supposed to be offered as well as something that you can take. It wasn't there as of a couple months ago, but now it's something that the health plans are offering.
My question is, many parents, they have to pay for private insurance for their college, student, and it can be very high. So would the children qualify for this new help?
Right. So under that's a great question. Under the ACA, they can continue to be covered up until the age of 26 under their parents' umbrella. If for whatever reason it's just not affordable for them to have their kids under their umbrella, they can leave the coverage, but MNsure has to deem that it's absolutely overbearing as a cost on the family finances. And so in order for them to leave that coverage that they have, remember that MNsure is for those who don't have it. How do we get those folks who don't have it to get it? If you have it and if you're being covered one way or the other, well, the only way that you can really drop your coverage is if it's just not affordable or if it's not covering your essential needs, healthcare needs. It's the only way that you can those two reasons why you would be allowed to drop and then join MNsure. So to answer your question, we'd have to put them through that test, and if we deem that it's good coverage at a reasonable price, then they'd have to stay until they're 26, and then they would be allowed to come into the marketplace and purchase through us. So I part of the reason why I'm here is to encourage you, to encourage the families that you work with to come to MNsure, and for you yourself to help facilitate the process, because you know they trust you, they work with you, they know you, and for them to understand that MNsure, again, with the benefits, how easy it is for them to compare and have more choice across the board, how some of them can qualify for some tax deductions to be able to pay for that premium, how some of them may not understand and know that they can get free insurance, and so yes, we're encouraging you to use the marketplace, and we're here to qualify people into free programs. If they may not be able to pay, if they don't want to pay and just want free insurance, period, well, that's not how the system works. We have to look at your income. This entire marketplace is based on income, so we have to look at your income. We have to make the determination, whether you're within a certain level, and we'll get, in the subsequent slides, we'll talk about the federal poverty level guidelines through the ACA. We'll talk about sort of determinations and how those occur. The way that you would explain it is that we're a marketplace, we're a store of sorts, and in that store there's a shelf. There's shelves when we go into the markets. There's shelves where people showcase products, and you get to choose those products, pick your product, go and check out, right? Very similarly how we explain that, and we explain that across the board. Medical Assistance Minnesota Care is one of those products that we're able to offer, that people can participate and take and check out with and purchase. Of course, you don't really purchase medical assistance and you don't purchase Minnesota Care, but it is a product that we offer on our shelf. It's one of the ways for you. So it really is a marketplace. It's a place where you can be qualified into medical assistance and utilize that product. Or if you don't, if you're making a little bit too much money, we may be able to offer you a different product, of your choice. There's 5 carriers and about 146 plans underneath those, actual health plans that you can select. Go ahead.
Yeah. I met somebody who told me he applied online for medical, for MNsure, and he was asked to pay $240 and he cannot afford it. So what can be my advice for that person?
Okay. This is a case where somebody came in to the marketplace and tried to apply for medical assistance, and he was given a charge of a premium that he has to pay on a monthly basis. This individual makes a little bit too much, probably, I just don't know his situation, but I think he makes a little bit too much money, and they were not able to move him into medical assistance because there are some very, very strict guidelines. We've amplified those guidelines now, so we've expanded those guidelines in Minnesota, but he may have to, in fact, purchase under the qualified health plan umbrella and purchase one of the health plans. They may have given him a preliminary sort of premium on a monthly basis, and so that this is the case probably in this situation. You have to be a U.S. citizen or lawfully, legally present to be able to participate in the marketplace. These are federal dollars that are sort of running the exchanges, and so you have to be here lawfully. So if you have an extended visa, or if you have some type of documentation that allows you to stay here, longer than 6 months, then you would probably be able to purchase on the exchange.
Can you explain a little bit more about the 6 months? What were you saying? Something about 6 months for undocumented? Can you say a little bit more about
yes.
The 6 month thing, whether they stay here for 6 months, or how the timelines figure into all of that?
Yes. So you have to be a U.S. citizen or a permanent resident or have legal status here. And usually a legal status is about a 6 month time period. We get questions on sponsorship. Well, I brought my parents from X country maybe 2 or 3 months ago. Well, the law says that you have to be here at least 6 months and have some type of permanent resident status, or have a status that allows you to be here for a determined period of time longer than 6 months. That's all I can say, sir, about that. Can't give you more details, unfortunately, about immigration and immigration rules.
So I have a person that has health coverage,
Mm-hmm.
not dental. So can they go to Minsure and just to get dental?
That's a good question. His question is, if you don't have dental, the marketplaces are primarily for you to get medical coverage, health coverage. As far as dental, that is not being offered right now for you to just go into the system to get dental. But that's a great question. So actually, there's 3 key ways to get help, right? If you're computer savvy, you go online, and and a lot of you are. So I encourage you to go online, create an account, pretend like you're buying coverage, go through the steps, right? Just don't purchase, right? Encourage you to do that. The contact center will not do enrollment. They will not do anything, but they are technical experts on all of your technical questions. You can call the contact center. There are operators that speak Somali, Spanish, and Hmong, and then we're using the DHS interpreter line, which many of you are very familiar with over 140 languages, I think. So you can actually put your folks on speaker and have them ask questions through the interpreter line. So I encourage you. The third is through the Assister Network, and we'll talk about the Assister Network. So how many of you are right now undergoing certification and training to be a navigator? Well, I don't know. I kind of thought that there would be more.
What have we got?
Right. Well, it's all dependent on the organizations that would sponsor you there to be a navigator. So it's by institution, and the institution selects the individuals. And a lot of institutions are employing community health workers who are then in turn becoming navigators. So it's a pretty intense certification and training. You have to. My understanding is it's about 16 hours of training, and about it's about 10, 11, 12 modules that you have to go through, so that you can really be prepared to really provide the assistance and help.
The second part of my question is I work with a lot of undocumented families, so can they be penalized because they cannot access and they cannot?
Great question. No, the individual mandate doesn't affect them. They're not subject to the individual mandate. But again, the one-on-one contact through the assisters and the networks, and we'll go through the roles of the assisters, because it's not just navigators. It's in-person assisters, it's brokers, agents, brokers, it's certified application counselors. It's a variety of different types that you can get direct one-on-one personal assistance.
Question: did they get a letter from their employer saying that they have to get health insurance? Can the employer ask for proof of health insurance?
Who are they? Define.
Undocumented workers that are working everywhere. They're getting a letter from their employers. Their employers don't know if they are documented or undocumented.
Yeah.
So they get the letter like everybody else,
Mm-hmm.
and they say, by law, you have to have health insurance by January 1st of 2014.
Mm.
So these undocumented employees are getting nervous.
Okay.
So they want to buy something, they want to do something. Can the employer come after them asking them for proof of health insurance?
So a couple of things. Employers should not be sending out letters about a mandate that doesn't exist. So this is good information, because we can take it back to Minsure. We do have a division within Minsure called SHOP, and they work with small businesses. And I think it's important for us to communicate to SHOP that more education needs to go to the small businesses about the individual mandate and how it affects. If they are requiring them to have health insurance and are trying to push them into the Minsure system, that won't work. So they need to be made aware that that's not going to work.
Well, the employers don't know that they are
Yep.
undocumented.
And outside of the marketplace, people may be actually purchasing outside of the marketplace, even if they are undocumented, and so can't speak to what's going on there. But that may be happening, even though it may not be the right thing that they need to be doing. So
You're saying that the employer cannot ask for proof of insurance?
there is no individual mandate for undocumented people. So undocumented people are not subjected to the individual mandate thus far. 3 things in order for you to be able to use the marketplace. 1, we talked about the citizenship requirements. Residency requirements. You have to live in Minnesota to be able to participate in Minsure. And you can't be incarcerated. You can't be in prison. Those are the three.
So if you work here, Wisconsiners come over to work, you know, in Minnesota, they can't shop Minnesota.
That's a good question. If they live
in Wisconsin.
and work
They
here,
in Minnesota.
well, if they fall under if their employer can cover them, they can use the marketplace. A small employer under the small employer umbrella, they can get covered through their small employer, even if they live in Wisconsin. So.
But let's say if they're individual, let's say maybe
Yeah,
they're a barber,
they've got.
a barbershop, you know.
If their main residency is Wisconsin, they got to use the federal exchange. And by the way, we are the lone ducks here in this part of the country in the sense that we are the only state-based exchange. Wisconsin has a federal-based exchange. Iowa, North and South Dakota have federal-based exchanges.
I thought they were doing federal and state.
North and South?
Iowa.
Well, it's a combination, but we are the only ones of our kind here in the Midwest. Okay, ma'am.
Okay, my question is, effective 2014, everyone has to have health insurance. What are the penalties? What would they be penalized if they still decide not to purchase a health insurance through an insurance?
So it's the first year. It's $95 or for 1% of your gross income, whichever is greatest.
They're gonna be fined?
Yes. You're going to be fined if you don't have health insurance. I'll say this about American Indian benefits. American Indian people are treated differently through the marketplace. First of all, and you have to be a member of a tribe that's federally recognized by the U.S. government as tribes. There are many, many Native people who live in urban centers who are American Indian and they talk about their tribe, but they're not federally recognized. And so the system is there for those folks. And the tribes, the Indian nations, the sovereign countries that are within the bounds of Minnesota, they get to manage all aspects of enrollment, and they serve as a third party to the marketplace. But there's a number of benefits that are not available to the rest of us that are available to the Native population. So I won't dive too much into it because Kate and I talked about, but there you will, if you are a part of any if you work with Native people, and you'll probably see me in other presentations where I will get more into detail. So lower your cost. So these tax credits or benefits that we talk about. So you can only get them through MNsure. You can't get them outside of our system. So individuals making up to about $46,000 will automatically qualify for some type of a tax credit. Families of 4 up to incomes of $94,000 will be able to qualify for tax credit. Cost sharing reduction. This is on deductibles, co-pays, co-insurance. Quickly, you know, I have to say this because I think Katie asked. So the premium is that monthly cost that we all pay that keeps your insurance policy alive. If you stop paying it, then the coverage ends. It's an agreement. Think of premiums, think of co-pays, co-insurance as contracts between you or your client and the insurance company. They will continue to provide and pay for services if you pay that monthly fixed amount, right? And co-pays are a form of co-insurance, you know, and so, you know, co-pays is something that it's your commitment to the health carrier and the health plan that you're going to pay something towards that actual service that was provided for you when you walk in the door and you get treated for a medical or health condition, and so it's your commitment. Then, of course, a co-insurance, it just varies from plan to plan, is that sort of percentage that you pay after you've met that deductible. And so what's fantastic is that these are costs. These are things that you have to pay out of pocket, and so what we want to do is reduce those through the marketplace. And so, so when we talk about the tax credit, this tax credit is unique. Most tax credits that we get, all of us have filed taxes, and you know we get a variety of different taxes. We get it at the end. You know, we file our taxes, and then you know we get the benefit at the end. With this one, you can get it right up front and utilize that tax credit to slashing many times your premium in half, if not more. So that's very important that we communicate. Well, how am I going to afford it? I don't qualify for medical assistance. Well, sir, ma'am, what can happen in very short order is you take the tax credit up front, and MNsure will manage all that for you. You don't have to worry about it, and we will pay your premium, and we will take care of your. We work in conjunction with and report to the IRS, the federal government, and we will take care of all of that for you, and that way it'll automatically lower your premium. So, as far as cost reduction, people within that 200 and 250% of the federal poverty level will get support to pay co-pays, deductibles, and co-insurance. So individuals earning between about $23,000 and $28,000 will get, and it just depends on, we can't give you figures because it depends on the plan that you choose at whatever level that you choose it. And families of 4 earning between $47,000 and $59,000 about. There are limits, caps for the first time, and so for individuals, it's for an individual it's about $6,000, and for families is about $12,000, and that's when you combine deductibles, co-pays, and co-insurance. Can't be more than these amounts, so they're capped. Critical point to mention here is that in order for the system to work, we need young people. We need the young invincibles, 18 to 36, so that it can balance out a lot of these costs. So it's critical that as you're out working with the younger population, that you educate them about the tax incentives, the tax credits, and how important it is for them to participate and contribute to the system so that we can continue to maintain these levels of costs.
What's co-insurance?
Co-insurance is a percentage of your cost after whatever service you got. After your deductible has usually after it's been met. It's a different type of way to help you pay for for out of pocket for things that you need that the plan won't reimburse you for. Yeah.
When you talk about support for those people in that FPL range,
Yes.
is that meaning like lower price co-pays and deductibles?
Yes. In addition to what they may already have. The health plans, like I said, are offering the lowest rates across the country, and in addition on top of that. Okay. So now I'm charting into familiar territory, medical assistance in Minnesota Care. So we know that qualification into it has been both expanded and simplified. There is still the paper application is still there, and it's still long, but through the system, the qualifying process is shorter, simpler. It's done faster, almost in real time within a certain time frame. So MNsure is the system that you use to see if you qualify for medical assistance. One important thing to say about Minnesota Care and MA, the Department of Human Services manages both programs. What is happening is if you're currently in medical assistance and if you are enrolled in Minnesota Care, your client should be receiving regular communication from DHS that gradually we are moving medical assistance enrollees under the MNsure system. And that should be clearly communicated. We will always co-manage Minnesota Care because Minnesota Care is a health-based insurance program. So Minnesota taxpayers, not the federal government, subsidize Minnesota Care. And due to state law, the Department of Human Services will always manage that. So we will, so we will co-manage, but they will always be that decider of what benefits, who gets to sell, public programs, what plans, the qualifying pieces, all of that will be defined and decided by DHS. But does that make sense? I know a lot of people have questions about, is Minnesota Care going away now that MNsure is here? It's not going away. And the management of it will still be done in conjunction with DHS.
So the people that have medical assistance now or Minnesota Care, they just have to wait for a letter to tell them what to do?
and guidance and direction from their case managers, case workers, those that are working with them, to make them aware that they're being moved under. The process is supposed to be seamless at this point. It's supposed to be done quickly, and so they don't have to reapply. That was a question that people had. Do they have to drop medical assistance Minnesota Care and apply into the MNsure system? No. We're just moving them under the system. So with medical assistance, as we know in Minnesota Care, costs are either free or minimal. The benefits are comparable. This is one of the things, Marcel, that you can emphasize as far as for those folks who are, well, am I getting a cheaper product? I'd rather just go and pay my doctor out of pocket for some medical expenses. I don't need free or I don't need charity. Well, the benefits are comparable to what you would be offered outside of medical assistance. Remember, it's the same carriers, right, that are offering public programs, right? Blue Cross Blue Shield manages public programs, and their networks and their provider networks. So, it's still the same as far as recipients can still maintain close contacts with their case workers, case managers that are either counties or community-based organizations. There has been an increase in the standards, so children under 19 can be moved into the program that are under 275% of the federal poverty level, children between 19 and 20, parents, caretakers at 133, adults. So these are the expansions that we talked about earlier. But again, we use your taxes, and we for medical assistance, we use the MAGI calculation, which no longer takes into consideration your assets, how many homes you have, how many cars, what money you have in the bank. They used to be able to utilize that to make a determination as far as whether or not you qualify for Medicaid. So it's based on household's taxable income, and its tax filing unit means the year before is when they make the determination.
If the parents are able to make it, but the kids are US born, they can apply?
Yes. Their kids can through their kids. If they're citizens, they can. So Minnesota Care, we followed in suit changes to income and asset standards. The asset test, we talked a little bit about that, for parents and caretakers is eliminated. Individuals who are eligible for medical assistance are not eligible for Minnesota Care. All of us, that's a pretty well-known fact, but we wanted to make sure that people understand that. The waiting periods are eliminated for those who had access to other coverage or failed to pay a premium. I'm not too familiar with this particular part, but the way it was explained to me is that it used to be that if somehow you missed a payment, you had to make those payments back into the system in order for you to get coverage. Well, that's done in the Minnesota Care.
How soon did that start?
So that starts in
For January?
Yes. So waiting for those who had access. So these are the two conditions: had access to coverage or failed to pay their premium. Yes. So again, each individual is required to pay a premium based on the income level. Through Minnesota Care, the system aligns premiums across, so they adjust it across your family size and income and household income. Again, we use the MAGI calculation to determine premiums. All of these are determined by the Department of Human Services, by the way. Okay. We talked about medical underwriting and how the big ones are gone. So pre-existing conditions can't medically underwrite you based on that or a current health condition. But starting in 2014, there are a couple of things that they will look at as they put a price on the health care that you're going to pay for. So whether you're an individual or family, where you live, your age, and whether you use tobacco. So these are we call them factors that would underwrite you, these are it. So whether you're getting coverage as an individual or as a family, your geographic area where you live, your age, and and whether you smoke and use tobacco. So this table is for those of you in the back, it's probably a little bit difficult, but you'll get the printout, so you'll be able to see it. This table kind of looks at your income and then what potentially you could qualify for. So let's say you're a single individual with income of up to like $15,000. You would automatically qualify for medical assistance, and if you have kids, they between the ages of 0 and 18, pregnant women would automatically qualify for medical assistance, all the way up to almost $23,000 as a single individual. If you make between you're a single individual and you make between about $31,000 and $46,000, you would qualify for tax credits. If you would make up to $22,023, you'd qualify into Minnesota Care. So this table is really fantastic. I think you should distribute this to the group so that as they're talking to clients and they get an idea of what incomes brackets they fall under, more or less. Because sometimes it could get confusing. Well, do we know what income is between 200 and 250% of the federal poverty level? Can you think about that right there on the spot? Well, these tables can help you kind of think about where you fall in terms of the benefits. Get covered. So, okay, great. Yeah, so here are the qualified health plans. I have to say that we heard, and this was public, and I can say this, we had heard initially at the beginning of the summer that there were 11 health plans that were interested in selling their products on our shelf. And but at the end, we ended up with 5. So these 5 decided to play by the MNsure rules and by the ACA rules. So Blue Cross Blue Shield, Health Partners Preferred 1, UCare, and Medica. The ACA mandates that if you are a QHP or a qualified health plan or carrier, that you provide levels of coverage, these 4 levels of coverage, the bronze, silver, gold, and platinum. And the levels really speak to what the health plan is willing to cover and what the expectation would be for you to pay. This is before your deductible is paid. Once your deductible is met, then they cover all expenses. And again, it varies. It depends on what kind of health plan you choose. But so how do we get started? And this is probably the most critical piece for those of you.
Yeah, I have a question. If you can go back to that previous slide. Yeah. Now, if a family has one daughter that has a pre-existing condition, which plan would be the best for them? I mean, how would that determination be made in terms of these 5 companies?
So we cannot use a pre-existing condition to qualify you into any level of coverage. All right, so how do we get covered? Steps to getting covered. So this is a technical aspect of the in-person assistance that you all can provide to your clients. But it really is, as they ask you, well, how does it work? How does a computer thing work? And one of the best analogies that I can use is, how many of you have shopped on Amazon.com? How many of you have shopped on Travelocity? Zappos? Wow, a lot of you. Zappos.com is where you buy shoes, right? That experience as a user is the experience that you want to draw upon when you are explaining the marketplace, because it functions very, very similarly in that you go online, you shop around, you don't have to get into purchasing mode right away. As if, imagine going to bestbuy.com and you want to buy a TV or you want to buy a Walkman or whatever. You really, the system allows you to just view the products. But once you're pretty much set that you're ready to purchase, you can, in pretty quick order, create an account, an online account. So you create a user name and a password. And then the system will ask you a series of questions about your needs, which will include costs. It'll include the kinds of benefits. Do I need medical, dental? What are your needs? You populate that. Out of that, we get a sense of whether or not you qualify. The system will automatically do the math for you, whether or not you qualify into medical assistance or you qualify into a qualified health plan. From there, you get to select the plan at the cost that you're able to afford, and then the last step is completing the application. So again, I really encourage all of you to at least go in and try the system, create an account, fiddle around with it to get a sense, as you are going to be educating your constituents and the folks that you serve. Get help. All right, so the system is evolving. Go ahead.
Oh, question, yeah. I mean, is there, if our customers don't have a computer, what would be other options for them as far as where they would go to get connected online?
So our system, both the website and the contact center, are accessible and to all populations.
So how would a client use the computer? I mean, if they don't have one at home, what would you suggest as far as where they ought to go to try and get hooked up with a computer?
They would call the contact center, and the contact center would send them to an in-person assister in their area. Would direct them, not send them, but direct them to maybe one or two or a couple, depending on how many are in that, where the individual works or resides, depending on their choice, to be given in-person assistance by an individual.
So, so then does the contact center bring a laptop then out to their home or something like that, or?
No, so the contact center would direct you, your person, Denise, to an in-person assister. An in-person assister would be located in a county office or a nonprofit organization or a business around the corner that could provide you with the type of assistance that you need to be able to enroll.
So it's that they'd have a computer, then the assister would have
Yes.
a computer.
Well, my question was, if a person is comfortable using a computer but they don't have one, could they go to a public library? But then my other question was, would that be safe to use?
Yes. Yes. So we take access into the system very, very seriously, and those of you who will undergo the training will realize how serious we are about data privacy and data privacy. All of the systems are secure wherever you go. It's really no different than if you were to do online banking at your local library. The systems are designed to interface and keep your information secure as you're in there doing your purchasing and doing your banking, in this case doing your purchasing.
Can I add to that? I think every county that hired a lot of workers.
Over 100.
Yeah. And in the future there will be a lot of organizations also will help clients in their organization.
This is a great, great question and comment. Yes, currently we have about 300 organizations. There's different institution types. There's government agencies, nonprofit groups, grassroots organizations that are signed up to take the certification training. Yeah. And out of those 300, an average of 3, 4, 5 navigators per institution. So it just multiplies the number of actual individuals that can help. So they're all currently undergoing, and we ask for your patience because not all of them have undergone training. Like I said, it's pretty intense training, and it's time-consuming, and it's an online training. So it's not a training that you're going to walk into a specific building and take it. So you can take it at your leisure, during the day, after work hours. I'll say one thing before it skips my mind here. The website is accessible. Right now it's in English. In subsequent rollouts, we will translate it into a couple different languages. We haven't determined which ones. But you can use, we are contracting with a Google Translate. I know it's not the best, but at least people can get a semblance of what the marketplace is. If your clients really, well, I really want to read this in my own language. Well, let's use Google Translate as you're sitting down with them, and they can ask you questions about the marketplace. Now, in the marketplace, there are fact sheets. We have a variety of brochures and fact sheets that you can download in Hmong, Somali, and Spanish. And as we are gathering intelligence from you guys at a local level, at a grassroots level, if you feel like there are some other languages that we need to translate materials into, it's important for us to get that feedback. Ultimately, we want to provide in as many languages as we can the material so that folks who can read in their language can actually take something home and have it with them to digest. But
Question here real quick about the other problem with the library. We've seen this. Some people want to be able to look things over through MNsure, but then they just have a limited, they maybe have a 20-minute limit. When they use the library computer, things move so slowly. It just, sometimes they can't finish, they time out. They're kicked off the computers before they can finish the work that they need to do.
Yeah.
So, because most libraries don't have a bandwidth that's wide enough, that's fast enough to be able to get through.
Our system is designed to interface with all platforms, across all platforms, and the libraries use some wonderful platforms. The time limitation, the good thing is that as you're noticing time limitation, you save your work. I think that if you get accidentally disconnected, I think it automatically saves any, wherever you left off in the application process, that we allow you to save your work frequently so that you can stay, so if you accidentally get cut off, and it might be the library cutting you off at 20 minutes, you might lose power in your house. Something may happen inadvertently and you may be locked out. There have been some glitches. Those glitches are being worked on and resolved. So the Assister Network, to answer Denise's question, who was asking about, will the people that help me, will they have technology? Yes. Part of the commitment to become a navigator is for you to be able to have access to the online system and the online marketplace, and that requires a computer, and that requires for your system to be able to interface with ours. And so these are the different types of assisters that are going to be available. I'll quickly go through them. Navigators. So navigators enroll into medical assistance and Minnesota Care, and they also enroll into a qualified health plan, both. Navigators get paid. To enroll folks into medical assistance and Minnesota Care, they get paid $20-some. To enroll into a qualified health plan, they get paid about $70, $75. The idea is that we want to equalize that at some point, and one of them is driven, the $70 is driven by federal dollars, which we control through MNsure. The other one is state dollars. Can't change state law overnight, so that's written into statute that amount is going to be reimbursed. A lot of our navigators are former MNCA partners, the association that is in charge and funded to do enrollment into medical assistance. That includes counties, nonprofits, et cetera, et cetera. Agents and brokers. Again, remember that another big population that we are targeting are those employees under the small business umbrella, 2 to 50. And so the agents that are allowed to work with insurance are agents and brokers by state law through the Department of Commerce. They're the ones that are allowed to work with those small businesses and help them through their insurance questions. So that's why they are a part of our network. Certified application counselors. This is a role that was created particularly for hospitals and clinics. We are noticing that a lot of libraries are now showing interest in getting certified as CACs. But that certified application counselor is that person at a hospital, let's say Hennepin County Medical Center. You walk in on an emergency basis, you can't show proof of insurance, so if they're able to, they direct you to that one person at the hospital that can qualify you into medical assistance or emergency care insurance. And so we are working with hospitals and clinics, encouraging them to get certified under the MNsure system so that they can be able to refer people into the MNsure system. So that's what a CAC is. CACs do not get paid by MNsure. They get paid through their own means.
Can I ask you something real
Sure.
quick? So the certification to become navigators and the certification for the counselors, are those two different?
They're the same.
They are the same. Okay.
And even agents and brokers undergo certification and training. They may vary. Some modules the agents may not be required to take some of the modules, but everybody needs to get certified under the MNsure system. There is an assister directory located right on the splash page of MNsure, www.mnsure.org, and you're able to access that list. It's a PDF list. It gets updated twice a week. As entities, as navigators, brokers, and CACs get certified, and we sign contracts with them, they get populated into that PDF. Right now they're organized by county, so we can actually look at all of the folks who are certified to provide direct assistance, enrollment assistance for Hennepin County. Trained and certified, and that's the way that we get they provide assistance. Again, I used to have a slide that talked about what were the requirements for you to become a navigator agent, and so there's a variety of different. There's a variety of different. So you have to be able to have some knowledge on good knowledge on enrollment and the qualifiers into the different types of enrollment. You have to be able to have the technology. You have to be culturally, linguistically competent. You have to be willing to do outreach. You have to be willing to provide in-person assistance as needed in a variety of ways. You have to protect the data and the privacy of individuals who you come into contact with. That is a very core important part of our work when we are working with vulnerable populations or populations that are not from this country or Minnesota. There's this issue of fraud, and so we need to make sure that these requirements are met. And when you go and do the training, you have to abide by all of those. So the individual mandate, as of January 1st, all U.S. citizens and legal residents will be required to have health insurance. There are exceptions. Individuals and families that fall within a certain income bracket are not required. People who cannot afford the coverage that is available even through the exchange. Individuals who have been uninsured for less than 3 months. Members of American Indian tribes. So their participation in the marketplace is not mandatory. It's voluntary. And those who don't purchase insurance because of religious objections. Let's see here. So here we go with the penalties. Starting in 2014, it will be the greater of $95 per adult, or 1% of your income, and it'll go up. So the following year, it's $325 or 2% of their income. So I'll say this about the individual mandate and costs. We don't want to hit people over the head with a mandate that, that would somehow scare people into getting the coverage. We want to be proactive and educate them as far as why it's important to have health insurance, what it does to their personal health, to their family, their well-being, the security, the fact that for the first time they have choice, they can select from a variety of plans, that the costs are at the lowest ever in the history of this country to purchase health insurance if you cannot purchase it right now outside of the marketplaces. So all of these positive things and positive reinforcements, but there is the individual mandate, and they should know that that there is a penalty. So the initial enrollment period, and this is just for the start, started October 1st, and it runs through March 31st. It's important for you all to know that, folks were thinking that October 1st was the deadline. It's not the deadline. We have plenty of time to get people certified who are going to provide in-person assistance to go out and help people move into the system. But after March 31st, we will kind of synchronize our time frame with what the industry does, and that is they enroll between October and December. I've been told to really emphasize that if people want to get covered the 1st of January of 2014, they have to have paid and be enrolled and paid their premium for those who are purchasing a qualified health plan by the 15th of December. 15th of December. If you are a small employer, business employer, you have to make sure that you paid your premiums by the middle of November, so that's a month before. So it's important for folks to get that information out.
One question, sir. If I'm paying, being covered by union's coverage, and it's high, can I drop that and then get to this plan?
Well, if we deem that the coverage you currently have through the union isn't fair and it's not equitable and it's not meeting your needs, equitable from the financial perspective, then you would be able to drop it. Yeah, if we deem it's too expensive for you. And there are people out there paying 20-30% of their adjusted gross income towards health care. It's way too much, and we're able to help you with that. I would never encourage anybody to drop their coverage before checking with MNsure first. So, and you can do the simulation yourself, or you can call the contact center, or you can talk to an assister and a navigator to find out, whether or not, you meet that 9% benchmark. But it's not just based on income. We do look at, are you paying, is what you're paying equal to or more than 9% of your total gross income? But we also look at whether, there are certain things that we deem important for you to be covered. Maternity, for example. Let's say your employer is just adamant they can't provide maternity for you. It's just too expensive. Well, that would be another thing that would allow you to drop that coverage and get maternity and get coverage through us, for example.
A person paying the premium, deducted monthly, is that through the bank? Do they pay it through the bank? If the client doesn't have a bank account, then what happens?
They can pay in cash, or by check, or cash. Yeah, we have the systems
and
to.
If they're late every month, what happens with that? Then they'll have a lapse in their insurance.
Well, then the rules kick in. Whatever the carrier's rules are as far as when you should be getting that. They should be receiving that premium. Those rules kick in. They may allow you a grace period. They may work with you. They may send you to collections. We don't know how that would be managed. But if you go through MNsure, we will be working with you on that.
Are the premiums paid right there and then immediately after the person has applied, after completing the application of first part?
Yeah, you can pay your premiums right now. You go online, you create an account for several of your clients.
People also not pay right away and just wait for the bill to come in through mail?
Well, yeah. What the question is why, well, I understand why they might want to wait. As long as we have that premium paid by December 15th, you're going to be good, and your coverage starts in January. If for whatever reason we don't get you in the system, and you walk in the middle of January, and we qualify you into a qualified health plan or medical or a qualified health plan, your coverage starts 4 weeks after that, or about a month after that. I'm going to put my information up here for those of you who want to follow up with questions. Mario Vargas at state.mn.us.